Assalamu alaikum. Today our lecture will be about the pelletogenesis or the development of the pellet. Usually development of the pellet starts at the end of the 5th week and completes at about the 12th week of embryogenesis, and the period between 6th week and the beginning of the 9th week is the most critical period for the development of the pellet. The pellet represents the roof of the mouth, separating between the nasal cavity and the oral cavity. It's composed of two parts, which are the primary pellet and the secondary pellet. The primary pellet, it usually develops at the beginning of the 6th week from the deep part of the intermaxillary segment as a medium palatine process. It lies behind the premaxillary part of the maxilla. Then it fuses with the secondary pellet later on, and the landmark of their union is represented by the incisor foramen. Here you see the pellet is composed of two parts, the primary pellet and the secondary pellet, and this is the site of the soft part of the roof of the mouth, which is the soft pellet. Here is the incisor foramen fossa, which separates between the primary and secondary pellet. The secondary pellet starts to develop as two lateral palatine shelves that arise from the maxillary process. As you remember, the maxillary process is derived from the first pharyngeal arch. It usually starts to develop also at about the beginning of the 6th week. The beginning, the two palatine shells usually they grow in the inferior medial direction on both sides of the developing tongue. This is the tongue. Later on, the jaws develop and grow. This will allows the tongue to take the more inferior position. So these two palatine shells, they take the horizontal position, they meet at the midline and fuse together, forming the secondary palate. Other fusion occur between this secondary palate with the primary palate. The landmark is the incisor fossa. Other fusion occurs between the secondary palate with the nasal septum. Usually fusion with the nasal septum begins anteriorly about the 9th week of development, extends posteriorly, and completes at about 12th week of development. The posterior part of the palate forms the soft palate. This is the muscular part. Ends with the uvula, this conic structure. During development, there are changes in the face. These occur or may result from changes in the proportions and relative positioning of the facial structures. In the early fetal period, the nose is flat and the mandible is underdeveloped. Here you can see a small mandible. The enlargement of the brain results in the formation of prominent forehead. The eyes are situated laterally on both sides of the head at the beginning and move medially later on until they settle in their normal position on the face. Ears first appear on lower portion of the lower jaw. Here is the site of the ears, as you can see. They grow in the upper direction to the level of the eyes. Here is the normal position of the ear. Some common anomalies which are related to the face, nose, and palate. They are named the facial clefts. They result from failure of the embryonic facial prominences to fuse properly. This picture shows normally developing embryo. These are the medial nasal prominences, these are the lateral, and these represent the nasal pits which will develop into nasal sacs and later on forms the nasal cavities. Here are the two parts of the maxillary process, and this is the mandible. Here you can see the primitive mouth, which appears large in size, and this is the developing forehead. These clefts or abnormalities could be unilateral or bilateral, involving lips only, palate, maybe lips and palate, maybe the region of the nasolacrimal groove. All these are the facial clefts. These anomalies may lead to difficulties breathing, in feeding, sucking, or swallowing, and even speech. Here you can see in this picture the median cleft lip, which results from failure of the medial nasal prominence to merge together and form the intermaxillary segment. This leads to this type of a cleft. This picture shows unilateral cleft lip due to the failure of a fusion between the maxillary prominence with the medial nasal prominence. Bilateral clefts result from failure of the maxillary prominences to meet and unite with the medial nasal prominences both sides. Now, the oblique facial cleft arises from failure of fusion between the maxilla and the lateral nasal prominence. The cleft palate could cause problems during nursing of the newborn. This could be anterior or posterior to the incisor foramen. It could be unilateral or bilateral, maybe isolated or associated with the cleft lip. Here is the normal appearance of the primary and secondary palate. You can see here this unilateral cleft lip. The cleft here extends, involving the lip and the unilateral side of the primary palate, whereas the cleft here appears bilaterally, involving the lip and the whole primary palate. You can see here the primary palate and the lips are normal, whereas the secondary palate shows a cleft in the midline. This is a severe case where the cleft extends, involving the lip, the primary palate, and secondary palate. Thank you for your listening.